Hello! In this video we're going to take a look at the development of the great arteries and the association that this has with the formation of so-called fetal shunts, which are very important for normal cardiovascular function in the fetus. However, what we should do first is look at the end product of this development of the great arteries, because in order to appreciate the development, we need to see what it is striving to produce. So looking at the image on the bottom left-hand side of this page, we can see a very simplistic description of the aorta with its distinctive arch. So it has an ascending portion, an arch, and then a descending portion. So this is the aorta. And the pulmonary trunk, which bifurcates into left and right pulmonary arteries. Now, the aortic arch has three major branches. We have the so-called Brachiocephalic artery at this point here, splitting into the carotid system, going up towards the head and neck, and also the subclavian artery on the right-hand side, supplying the right upper limb. Then moving leftwards, we have the left common carotid artery coming directly off of the arch, followed by, on the extreme left-hand side of the arch, the left subclavian artery here. So we are going to look at how we can go from a single structure, that is the truncus arteriosus, to this rather complex organisation of the aortic arch, pulmonary artery and their branches. So let's just focus in on the region that we're going to be considering in more depth. And we've considered this region before, because what we're going to be thinking about is the top end, the rostral end of our primitive heart tube, but I'm going to draw it again for your benefit. So here is the top end, here is the primitive ventricle, here's the primitive atrium, and then here we have our various veins coming in, the sinus venosus. Okay, and you should recall that blood goes in down at the bottom end into the veins, passes from the atrium to the ventricle, and then comes out through the top end. And the top end here, this bit that bifurcates into these two branches, is called the truncus arteriosus. The truncus arteriosus, and we can see that labelled on the diagram on the top right-hand side, the truncus arteriosus. And it is the truncus arteriosus which is going to give rise to both the aorta and the pulmonary artery. So the truncus arteriosus itself is ultimately going to become septated and go from one large vessel to two large vessels, each communicating with their respective ventricle. We also have this more distal structure, the aortic sac, but we're not really going to consider that in any more depth. So on the diagram on the top right-hand side, the heart would be sitting here, in a relatively anterior or ventral position. And the heart, through the truncus arteriosus, communicates with a pair of vessels, one on the left and one on the right, and these are known as the ventral aortae. Okay, so in the embryo there are four aortas, etc. There are four aortas, two ventral aortae and two dorsal aortae. Okay, and the ventral aorta and the dorsal aorta are connected by these arch vessels. Now, isn't this a strange situation? It seems to bear very little resemblance to the condition in the adult human. And the reason for this is, in the embryo, as in the adult, we are filled with vestiges from our evolutionary past. And in fact, this arrangement is what is seen in fishes. All right? In fishes, each of these so-called aortic arches, these looping vessels, these are the vessels that supply the fish's gills. So the heart pumps deoxygenated blood into the ventral aortae, it passes through the aortic arches, becomes oxygenated in the gills, and then is distributed to the body through the dorsal aortae. Okay? So we are left with our evolutionary history, and the human body is built upon the materials that it is given. So what needs to happen is that there needs to be considerable remodeling of this structure in order to go from the complete set of aortic arches to the adult condition. So there needs to be a huge amount of remodeling. Now, let's add a few other just very simple introductory points before we start looking at this in detail. A very important point that you need to get clear in your minds is the definition of an artery versus the definition of a vein. Naively, you might think that arteries carry oxygenated blood, whilst veins carry deoxygenated blood. This is true to a certain extent, but has some really important exceptions. A far better definition, and in fact the definition of arteries versus veins, is that arteries are vessels that carry blood away from the heart, so we're focusing on the bottom right-hand image now. Arteries are vessels that carry blood away from the heart, that being the aorta and the pulmonary arteries, whilst veins are vessels that carry blood towards the heart, that being the vena cava and the pulmonary veins. Strictly speaking, the definition of an artery and vein has nothing at all to do with the oxygenation level of the blood contained within. So we need to get that clear. But this discussion that we're going to be going through is focusing on the arteries. So we're talking entirely about vessels carrying blood away from the heart. The second caveat I want to point out to you, and before we look at the aortic arches in more detail, is that there are 5 aortic arches, and you might think it is a typo that it goes from 1, 2, 3, 4 straight to 6. In fact, in humans, the 5th aortic arch degenerates and is not seen at this stage of development. We know that the 5th arch exists because we see it in other animals during their embryonic development, but it is not present in humans. So there are 5 aortic arches that we need to discuss: 1, 2, 3, 4, and then 6, because the 5th is not present. So now that we've discussed these various caveats, we can now move on to a more detailed discussion into how these aortic arches are remodeled to give us the adult condition. And the first thing that we're going to do is we're going to draw on the aorta and its ascending arch and descending portions. So I'm going to select a red pen because this is, of course, the aorta we're talking about. And remember that the aorta must connect to the primitive ventricle. And we said that the primitive heart is sitting here. So the aorta connects to the primitive ventricle. And the aorta is actually a derivative, the aortic arch rather, is a derivative of the 4th aortic arch. So the adult aortic arch comes from the 4th aortic arch in the embryo. So if I want to draw the aorta, I would draw it like this. Okay. So I've drawn on there the adult aortic arch, and you can see that it is looping. Okay, so it's looping around just like the aortic arch that we saw in the adult condition. Now, of course, the aortic arch has a variety of branches, and I'm not going to show you all of these branches because they're not actually all that relevant to our discussion of the fetal shunts, etc., that we really need to understand. But I'm going to show you a couple of the branches of the aorta and how they develop as well. So a major branch of the aorta, the aortic arches rather, is the right subclavian artery. And the right subclavian artery itself is developed from the 4th aortic arch. So we need to draw on the right subclavian, and the right subclavian goes like this. Whoops, so I just did rub that out actually. The right subclavian develops like this. Okay, so we drew the aortic arch here, looping around. And here, this is the right subclavian artery. So let's label that. So that is the right subclavian. And that's going to the right upper limb. Let's also think about the vessels supplying the right-hand side of the head and neck. So that would be the common carotid artery. So the common carotids are, the carotid system is developed from the third arch and portions of the ventral aorta. So what we need to do here is we can draw one branch going up here, a continuation of the ventral aorta, and then a second branch forms here, looping around like this. Okay. These two branches that we've drawn here represent the carotid system, which goes up towards the head and neck. And you'll learn that there's an internal carotid and an external carotid when you do head and neck in the second year. But all that we need to say is that these are the carotids going up towards the head and neck. Okay? So, the branch that we have demonstrated the development of, i.e. this branch here, is in fact corresponding to the brachiocephalic artery. So this here corresponds to the vessel here, which is the brachiocephalic artery. You see in the adult, the brachiocephalic artery gives rise to the carotid system and the right subclavian. Once again here, the brachiocephalic artery in the embryo gives rise to the carotid system and the right subclavian. So we can start to get a feel for how in the embryo we go from this complex set of aortic arches, and by selectively retaining some elements, we can start to build the adult anatomy. So, and that is how this is working. You know, I just want to emphasize, these branches aren't kind of growing de novo like this and forming the pattern. We start off with the whole thing, and the branches that I am drawing are retained, whilst other branches are lost. Okay, so this is remodeling, this is re-sculpting the original organisation that the embryo has. So we've demonstrated how we're starting to form the aortic arch with its ascending portion, the adult aortic arch and then the descending portion. And we've also seen how the brachiocephalic artery forms, branching into the right subclavian and the carotids. We've considered how the main adult aortic arch comes from the fourth aortic arch in the embryo, and we've seen how the right subclavian also comes from the fourth arch, but that the carotid system is more closely associated with the third arch. So that's the systemic arterial system, and yes, there are many more branches whose development we could discuss, but I'm choosing not to do that just for the sake of clarity. Now let's think about the development of the pulmonary arteries. And just for clarity, I'm going to use blue to talk about the development of the pulmonary arteries. The pulmonary arteries, like the aorta, develop from the truncus arteriosus. And both pulmonary arteries are related to the fourth arch. Okay? Both pulmonary arteries, actually, sorry, I made a mistake there. Both pulmonary arteries are related to the sixth arch. So let's draw the left pulmonary artery. The left pulmonary artery grows like this. So here it is, the left pulmonary artery forms from the sixth aortic arch. And the right pulmonary artery forms from the sixth aortic arch on the other side. Okay. So here we can see that both aorta, its branches, and the pulmonary arteries are developing from the same primitive set of aortic arches, but the adult aorta and its branches are more closely associated with the fourth and third arches, whilst the pulmonary arteries are more closely associated with the sixth arches. you can see how I've drawn these, that the pulmonary arteries are then coming round anteriorly to plumb in to the developing lungs. Now, this isn't the whole story with respect to the pulmonary arteries, because on the left-hand side, and let me just emphasise this to you, here's the left and this is the right. On the left-hand side, the sixth arch, more of the sixth arch is retained than on the right. So on the left-hand side, in fact, what we see is that all of the sixth arch is retained and enables that pulmonary artery to join up with the aorta. Okay? And this is a very important shunt within the fetus, and we're going to discuss this in more detail, so we're not going to talk too much about the functional implications of this, but suffice it to say at this point that this is a very important way for blood to get from the pulmonary circuit to the systemic circuit in the fetus, and that is, it goes through this structure here from the pulmonary artery into the systemic circulation, okay? And this structure here is called the ductus arteriosus, okay? So that structure there is called the ductus arteriosus, and we're going to talk about that a lot more in the next slide. However, we can see the ductus arteriosus in the adult there, and also it's visible just there on our adult image. And furthermore, just to make it clear to you, as clear as I can make it, the ductus arteriosus is just there where I'm pointing to, connecting the pulmonary vessels with the aorta. But I'm going to delete that ductus arteriosus because I want to, I just want to show you something else. Right, so let's just get rid of that arrow to the ductus arteriosus, and then we can move on. Okay, fine. So the ductus arteriosus, very important right to left shunt in the fetus. On the right hand side, the ductus arteriosus does not form, and so this region here of the sixth arch degenerates, disappears, okay? So this region here of the sixth arch degenerates and doesn't form anything in the adult. And that is very, very interesting. It's very, very interesting because it's closely related to the development of an important nerve. This nerve you will encounter more in head and neck. However, we'll talk about it now because it's a good opportunity to discuss it. The nerve in question that we're going to be discussing is the recurrent laryngeal nerve, which is a branch of the vagus nerve. So the first thing I'm going to do is I'm going to draw on the two vagus nerves. This is highly diagrammatic. I'm not trying to demonstrate the anatomical relations, but here are the two vagus nerves. So here's the right vagus, and here is the left vagus. Okay, and I'm going to label this as cranial nerve 10 because that's the number, the cranial nerve number that the vagus corresponds to. Now, the vagus, as you should know, is a very important nerve carrying many, many functions, but primarily it's a parasympathetic nerve supplying the heart and the GI tract. But furthermore, it is also a motor nerve sending impulses to the larynx. Now, during development, the vagus nerve sends off two major branches which go back up towards the head. Okay? On the left-hand side, and I'm going to use a slightly smaller pen to depict this, on the left-hand side, a branch comes off of the vagus and goes in this direction. Does that, okay? This branch on the left-hand side is the recurrent laryngeal nerve going up to the larynx. So I'm just going to call that RLN, the recurrent laryngeal nerve. So this branch that came off of the vagus nerve loops back on itself, goes behind the ductus arteriosus, which, as you should recall, is derived from the sixth arch, and then goes all the way up towards the neck, where it's going to innervate the larynx. The same thing happens on the right-hand side. So the recurrent laryngeal nerve comes off, goes up in this direction here, and ultimately goes up to the larynx. But can you see the difference? There's an important distinction to be made here between the recurrent laryngeals on the left and the right-hand sides. On the left-hand side, the left recurrent laryngeal finds itself trapped, hooked around the ductus arteriosus, which is derived from the sixth arch. However, on the right-hand side, this part of the sixth arch here, which formed the ductus arteriosus on the left, has disappeared. So this left recurrent laryngeal nerve actually sits, this right recurrent laryngeal nerve actually sits higher up than the left recurrent laryngeal nerve. In fact, the left recurrent laryngeal nerve loops around the arch of the aorta, closely associated to the ductus arteriosus, whilst the right recurrent laryngeal nerve loops around the right subclavian. So if I try to show you this on the diagram of the adult aorta, the left recurrent laryngeal nerve kind of does this. So does this, then around and back up. Whilst the right recurrent laryngeal nerve, here's the vagus going down, but the right recurrent laryngeal nerve goes around the right subclavian. So I hope that that's clear. It may be the case that you need to go and do some more reading about this just to clarify it in your head. And it's not the easiest thing to explain. But the key factor at play here is that due to the fact that the sixth arch on the right-hand side disappears, the right recurrent laryngeal nerve actually originates higher up in association with the right subclavian than the left recurrent laryngeal nerve, which is retained in a lower position by the presence of the ductus arteriosus connecting the pulmonary arteries with the aorta. So that's all I want to talk about with respect to the aortic arches. This is a very interesting area, and if you want to dig into this in more detail, I do recommend it because it's tremendously fascinating and satisfying when you start to develop a more detailed appreciation of how these adult anatomical structures develop. But that's all we're going to talk about with respect to the development of the great arteries. Let's move on to some fetal shunts. So, in the fetus, we have this process known as shunting, and specifically this is right to left shunting. What shunting means, you can actually, instead of the word shunting, you could replace it with the word bypassing, all right? Because in the fetus, there are certain tissues that can be bypassed due to the fact that the placenta performs their functions for them. And of course, the classic organ that can be bypassed in the fetus is, of course, the lungs, okay? The lungs are not required by the fetus because the fetus does not breathe air. So in that case, it would be a waste to send valuable blood to the lungs when they're not going to be doing anything. So we need to bypass the lungs somehow because the placenta can do their job. The second tissue which can be bypassed is the liver. Remember, the liver has many functions, but a large part of its function is detoxification. But the detoxification functions of the liver can be carried out by the placenta. So we can bypass the liver as well. So in the fetus, we have three important shunts which help to bypass the lungs and the liver. Let's deal with the ones relating to the lungs first. The first one, in relation to the lungs, we're going to be focusing on the diagram on the right here. The first one is one that we've already discussed the development of, and that is the ductus arteriosus just here. The ductus arteriosus, remember, connects the pulmonary arteries to the aorta, okay? And that means that blood which might have been destined for the lungs through the pulmonary arteries goes straight into the aorta and into the systemic circuit. So we're not wasting blood on the lungs because we're sending it through ductus arteriosus. The second major shunt that helps us to bypass the lungs is through this structure whose development we have not yet discussed but which will come up later, known as the foramen ovale, or the oval foramen in this diagram. The foramen ovale is, if you like, a one-way valve connecting the right atrium to the left and shunting blood from the right-hand side to the left-hand side, thus once again bypassing the right ventricle and the pulmonary circuit. So the foramen ovale carries blood preferentially from right to left, meaning that blood, instead of going to the lungs, is going to the systemic circuit and helping the fetus to grow. Now, often in diagrams, you see that these shunts are depicted as being relatively small, but I've managed to find this beautiful diagram on the left-hand side of a fetal heart. And what you can really see, this is ductus arteriosus here. And ductus arteriosus is really quite big. It's almost the same calibre as the pulmonary trunk. So this is a large structure. This is a large structure which carries a substantial amount of blood. So those are the two shunts relating to the lungs. The third shunt relates to the liver. And what you need to remember is that blood is coming from the placenta through the umbilical vein just here, okay? Blood is coming from the placenta through the umbilical vein here. You might be thinking, that's weird. This is a vein, but it's got, inverted commas, red blood in it. But it's going towards the heart, so it is definitely a vein, okay? So once again, that definition of arteries and veins, arteries away from the heart and veins towards, is so important. Now, this umbilical vein connects to a structure known as ductus venosus here, which then goes straight to the inferior vena cava and to the right side of the heart. So ductus venosus bypasses the liver, so that blood is not getting processed twice, if you like, once by the placenta, once by the liver. Now, of course, in the normal adult situation, these three shunts will close soon after birth. So what we find is that when the fetus takes its first breaths, the resistance in the pulmonary circuit drops and the pressures within the left atrium increase, and that closes foramen ovale. Furthermore, at birth, soon after birth, the ductus arteriosus starts to close, as well as the ductus venosus. And all three of these structures have, in the adult, visible remnants which can be seen. All right. So, for example, ductus arteriosus forms this structure known as the ligamentum arteriosum, which connects the pulmonary artery to the aorta. So that's all I wanted to talk about with respect to right to left shunts in the fetus. Thank you for listening.